Hi there, Doug Lindsay here with 10 slides in 10 minutes. Your financial questions answered in 10 minutes or less. For this video, I'm assuming you have a basic understanding of how the Medicare program works. If you're unfamiliar with Medicare, see our introductory Medicare video to learn the basics. This video will specifically cover Medigap versus Medicare Advantage plans. This rather blurry image came from the Medicare and You booklet. It shows that there are two ways to have Medicare. If you go with original Medicare, you can sign up for Parts A and B. Then you decide if you want prescription drug coverage under Part D. This shows drug coverage is optional, but it can be dangerous to go without drug coverage, so we are recommending that everyone have it. In Step 3, you decide if you want supplemental or Medigap coverage. Again, Medicare shows this as optional, but we think it's vital because Medicare leaves too many coverage gaps. The second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. There are many companies offering Medicare Advantage plans, so if you go this route, it will be important to shop for plans and find one that meets your needs. And again, drug coverage is shown as optional, but we recommend that you choose a Medicare Advantage plan that offers prescription drug coverage. Private Medigap plans cover most or all of original Medicare's out-of-pocket costs. If you select this option, you will continue to be covered by original Medicare. After Medicare has paid your claims, it will automatically forward them to your Medigap plan. The Medigap plan will then pay its portion of the bill. For example, if you're in the hospital, this supplemental plan will pay your $1,288 hospital deductible. Your Medigap plan will also pick up the 20% coinsurance for doctor visits under Part B. Medigap insurance policies are standardized. They're identified by the letters A through N, so if you buy a Plan F in New Mexico, it will offer the same benefits as the Plan F in Florida. However, the premiums can vary considerably from company to company and from area to area. For example, in one Florida county, the monthly premiums for Plan F ranged from $192 to $465 per month for the exact same policy. That's why it is so important for you to carefully evaluate Medigap insurance and not pay too much for it. Medigap plans do not cover prescription drugs. Therefore, you must also purchase a standalone Part D plan if you want drug coverage. Nor do these plans cover long-term care, vision, dental, hearing aids, or private duty nursing. And they do not work with Medicare Advantage. You pick Gap or Advantage, one or the other, but not both. The second way to get Medicare coverage is through a Medicare Advantage plan, also called Part C. These plans are offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing the care. You still have to pay for Parts A and B. The cost of Part A is determined by your work history, so for most of us it is free. But you still must pay the Part B premium, $121.80 per month as of the time of this video. You will have to use the local network's doctors or hospitals, think HMO. You'll want a plan that includes prescription drug coverage, and you may even be able to get extra benefits like vision care, but the benefits and cost sharing for Medicare Advantage plans are different than for original Medicare. So again, you'll need to shop carefully and choose a plan that fits your needs. Some providers offer a PPO plan, which widens the network across the state or across the country. Here in Albuquerque, for example, Presbyterian is one of a number of Advantage plan providers. They offer 3 different HMO-type plans. One plan has a monthly premium with lower copays and deductibles and includes drugs. The mid-tier plan has no monthly premium but higher copays and deductibles and also includes drugs. And a third plan has no monthly premium but does not include drug coverage. No matter which of these 3 plans you choose, you still must pay your monthly Part B premium. With these plans, you are restricted to local Presbyterian hospitals and doctors. If you choose to see a doctor out of plan, say a specialist at the Mayo Clinic in Phoenix, for example, you will pay 100% of the cost. For those of you still working for a large employer, that is 20 or more employees, you don't have to do anything when you turn 65. You can keep your employer-sponsored health plan until you retire. They may ask you to sign up for Part A. For everybody else, you must sign up for Medicare at age 65 regardless of whether you are a retiree or still working and covered by a group plan. But you may have alternatives to Medigap or Advantage Plan secondary payer coverage. Retired military and federal employees have their own options. Retirees from large employers may receive coverage as a benefit, but they still must have Medicare as the first payer once they turn 65. Going without a gap or advantage plan is a bad idea. If you only have Parts A and B coverage, a medical emergency could quickly wipe out a lifetime of savings because you have unlimited financial liability. Let's look at the benefits of gap or supplemental plans. The big one is choice. You can travel anywhere in the U.S. and see any provider who accepts Medicare as payment. Advantage plans are usually restricted to a local market. If you travel a lot, you'll want to consider this gap plan benefit. Many gap plans also cover 80% of foreign medical expenses. Medigap costs can also be more consistent than Advantage plans. For example, if you buy Plan F for $200 per month, your annual cost will be $2,400 plus the cost of Part B and drugs. Since Plan F fills in most of the expense gaps for you, your costs are known. This can make budgeting easier. Contrast this to Advantage plans, which have annual out-of-pocket spending limits. The 2016 average is $5,257 per year. As long as you're healthy, this won't matter as you likely won't hit the limit. But when you're sick, you'll have to spend $5,257 against copays and deductibles during the year before the insurance company agrees to pick up all costs over this limit. If you prefer steady, known monthly premiums, a Medigap plan is a good fit. If you're more of a risk taker, you may select Advantage with a reasonable out-of-pocket limit and cross your fingers that your good health will keep you under the annual out-of-pocket limits. Let's look at the benefits of Advantage plans. The big one is coordinated care. All of your care will be provided by one group of doctors and hospitals. There is likely to be less complexity here than with a gap plan, where you can have 4 different parts of Medicare working together. Advantage plans often include drug coverage and may include other benefits like dental, vision, hearing, and gym memberships. Advantage plans have rating systems at both Medicare.gov and by the NCQA, the National Committee for Quality Assurance. This is a not-for-profit organization dedicated to improving healthcare quality. Finally, your wallet may be thinner because you'll only have 1 card instead of 3. Again, back to the benefit of simplicity. The website for the NCQA is listed below. Here's a checklist to help you think through this decision. If you currently have relationships with doctors you like, ask them how they work with Medicare. Are they part of an Advantage or Gap plan? Neither? Both? Next, how do you prefer to budget? Do you prefer the predictability of known monthly costs? A Gap plan may be appealing because the monthly costs are relatively stable. This could be particularly appealing if you already visit doctors and hospitals regularly. If you're healthy, an Advantage plan may cost less per month for now, but if you get sick, that annual out-of-pocket maximum will kick in. If this continues year over year, the Advantage plan may cost more than expected, and it is difficult to switch out of an Advantage plan to a Gap plan without medical underwriting, which may make your new plan unaffordable. Will you enjoy extended travel during retirement in the U.S. or abroad? Medigap plans can be a better fit for folks who like to travel, whereas Advantage plans may be a better fit for the occasional traveler or homebody. If you're currently on prescriptions, which plan covers your drugs? And finally, what extra benefits might an Advantage plan offer and how do you qualify? All of these factors play into your selection between original Medicare with both a Gap and drug plan versus an Advantage plan. The website listed below can help you with this decision. Switching between plans can be tricky. From the insurance company's point of view, somebody who has selected a plan and now wants out may be a bad customer, technically known as adverse selection. An insurance company does not want to take on a new customer with a serious illness who is unhappy with their current coverage. So there are rules to changing plans midstream. Switching from one Advantage plan to another is easy. You can do so during open enrollment every year from October 15th to December 7th with no worry about pre-existing conditions or underwriting. Coverage begins the following January 1st. Even if you are happy with your current coverage, it can pay to shop around as plan rules and costs change every year. Switching from one Gap plan to another without going through medical underwriting is trickier. You can do so anytime during your initial Medigap open enrollment period, 3 months before and after your 65th birthday, or once you retire and leave your large employer's health plan. After that, you have to meet one of the special conditions listed here. Call both your current provider and your prospective provider before canceling your current coverage to determine if you qualify for the change. During open enrollment from October 15th through December 7th, you can switch from Medigap and Original Medicare to an Advantage plan. Careful, switching back is harder unless you're still in your trial right, in which you could go back to the same Medigap policy issued by the same company. Otherwise, you will be subject to medical underwriting where a pre-existing condition could drive up your gap premium cost. Switching from an Advantage plan to Original Medicare and a gap policy is tough. Underwriting will apply unless you have a guaranteed issue right as listed below. For example, you move out of the Advantage plan service area or your plan is leaving Medicare. Shop carefully before you select a plan and figure you're going to be with it for the long haul. The website at the bottom of this slide is a good place for more information. There are lots of resources available to help you. Here are a few. Each state has a State Health Insurance Assistance Program, or SHIP. The phone number and website for New Mexico's program are listed here. You can also visit the Medicare Rights Center. This national nonprofit consumer service organization works to ensure access to affordable health care for older adults and people with disabilities through counseling and advocacy, educational programs, and public policy initiatives. The Medicare website and the Kaiser Family Foundation website both have lots of information on choosing plans. Finally, check out the Consumer Reports magazine or website. Good luck on your search for medical insurance that works and is affordable. As always, you can call our office for assistance. We're your advocate for all things financial. That's the end of this session of 10 slides in 10 minutes. Hope you enjoyed it. I'm your host, Doug Lindsay. If you need additional information, remember to go to our website, and please tune in to our next session. As always, contact us if you have questions.